Hello, everybody, and welcome back to another ARP Q&A. My name is Jake. I'm the ARP trainer, and Matt Dell is with us, our CEO for ARP. Matt, you're in Chicago, and you look happy and rested. How are you feeling?
And cold.
You're cold?
It's cold up
colder?
here, brother. Yeah,
I'm sorry,
but
you
it's
get
all
back
right.
down here.
It's a perfect out. It's like a winter day getting ready for a fall football game or something. I don't know, but it's all good. This is perfect Q&A, perfect Q&A weather. Let's call it that way. You've shown off your palm trees there, but I am extremely thrilled with who we've got on today.
Yes.
So let's not listen to my banter. Let's dive right in. Tell us a little about who we're going to talk with, and really excited.
Perfect. Yeah, let me give a brief intro, and there's going to be a video afterwards. But joining us today from Naples, Florida, we have Dr. Chris Ellis and Amanda Salazar from Dynamic Physio Therapy. Known for their personalized results-driven care, they specialize in treating active adults and athletes through a powerful blend of techniques ranging from ARP neurotherapy to dry needling, cupping, scraping, and mobility-based rehab. With a hands-on root cause approach, Chris and his team are helping clients recover faster, move better, and get back to doing the activities in sports they love with confidence and strength. Please give a warm welcome for Dr. Chris Ellis and Amanda Salazar from Dynamic Physio Therapy.
I've had this pain for probably 6 or more years, and I've gone to 3 therapists over the past year. Nothing worked until I got hooked up with this team, and they started doing this electronic stimulation. And golf is going very good for me now. I have no pain when I'm playing. I got the home unit so I can continue to build up the strength in my arms and shoulders, feeling good and getting my golf game back to being close to a scratch golfer.
I love it. Welcome, guys.
Hey, guys. How's it going? Thanks for having us on.
Wow,
good to see you both again.
So good to see you. I'd love to dive in. I know you guys, I haven't seen you in quite a while, but Dr. Ellis, please share to our audience a little bit about the history, your clinic, how you started, why you started. Tell our listeners a little bit about your clinic.
Okay. Well, I got a lot of stories, but I'll try to keep it brief. I mean, I got into physical therapy myself just through my own rehab because I broke my back many years ago. And I've been practicing physical therapy for about 12 or 13 years now. About 6 years ago, I opened up Dynamic Physio. I was a clinic director elsewhere, and I just wanted my own space and I wanted my own way to treat patients. So that's why I opened Dynamic up. And it's been great since then. I brought in Amanda. Amanda's an occupational therapist. She also has a specialty in lymphatics. So through all the things that we all the tools at our disposal, we are able to solve a lot of problems.
That's great. And so, Dr. Amanda, tell us a little bit about your background, how long you've been working with Dr. Chris.
Yeah, so I've been an occupational therapist for going on 11 years now, but I've been with Dr. Chris for about 3 of those. I do a couple different things, but we started having a conversation about the lymphatic system, and similar to the way he got started in therapy, his interest in it, I had a lot of personal situations that led me to needing some of these same therapies that now I'm helping, provide to other people. So, we're on the same page with a lot of stuff, and we feel like we have some unique things that when we bring them together, we're able to, provide something that isn't really being provided otherwise, or elsewhere.
Yeah. Oh, good. I don't recall. So Dr. Ellis, tell me, how did you find direct current? What other modalities do you guys use? Maybe give our listeners a little bit of background of where you started 6 years ago and how you've evolved to adding direct current into your practice.
So I have a bunch of different electric therapies. I use what's called a Mark Pro for recovery. I used NMES, like TENS units. I use Russian stimulation. And then it was maybe 2 years ago, I think, is when I was introduced to CHIP. And that's where I discovered the ARP Neuro. And it's just way more powerful than anything I've used for a passive modality.
Okay, good. And how does it compare to, give our listeners a little bit of, how does it compare, starting with the TENS unit, the Mark Pro, and Russian stem, and now, the direct current with the modality?
Well, so there's a different application. So the Mark Pro, it kind of pulses on and off. So that's meant to stimulate muscle pump for lymphatic system. And MES is basically almost like a distraction for pain. Russian stim is a little bit similar to Mark Pro in that it turns on and turns off. So we use that sometimes with like a stroke rehab, for example. This stimulus is like, I don't know, 100 times stronger than any electric stimulation I've used. And what I like about it is that we do active movements with it. All the other ones are much more passive modalities. This is kind of a combination of active and passive. So I think about this from like a pain science perspective. So I think this is a tool that I love using to solve chronic pain, because the nervous system learns like that certain movements become painful. For example, if stairs bother your knee, and every time you go up and down stairs, it's just a reminder the knee is still bothering you. What you can do is put this stimulation on the knee and do that same movement. Instead of feeling pain, you're feeling that stimulation. So in a way, it kind of rewires the brain.
Awesome. I always love to ask the question, so we'll start with I'll skip you, Dr. Ellis, and go right to Dr. Amanda. And give us some of those aha moments as you started treating patients and had clients in. I love to ask those moments when the patient kind of woke up or was blown away. Tell us listeners a little bit about some of those aha moments where you were working with somebody and saw the great results of direct current.
Yeah, I think one stands out in particular, I think for a couple reasons, but one, she came in very skeptical. She was not only skeptical about modalities and things like that, as a lot of people are, because sometimes they feel like they're just used, oh, I'm going to put this on you and leave you to the side, and you're not really getting, one-on-one therapy, which is one of the things that I love about this, because that's not the case. So she was very skeptical. She was also kind of just tired of, she had been dealing with this for a couple years, seen other practitioners, and just had no luck, and felt, she was a pretty competitive pickleball player, golfer, and she wasn't able to do any of those things anymore. She couldn't even sit at a restaurant because her sciatica was so bad. And she came in, and we got to the end of that first, 10 session thing, and she was kind of on the fence if she was going to keep going. And then one day she came in and she was like, Amanda, guess what? She said, I just went, with my husband, just kind of watching him. I decided to try to shoot, she said, I played an entire round of golf. She said, no pain. And she was like giddy.
Yeah.
Is the only word I can use to describe it. And, so we continued because it was chronic. We did do a few more than, you might typically. And by the end of it, she was not only playing competitive golf and pickleball again, but she and her husband booked a 6-week RV trip, which, to go from not even being able to sit through a 2-hour dinner to sitting in an RV to take a trek across the country for 6 weeks is, that's huge.
Yeah.
And 20 visits with me, 20, 30-minute visits.
I know exactly who she's talking about. This woman could not even sit on my cushy treatment table without pain.
Wow.
Getting up and down from a standard chair was painful.
Yeah.
I love it. Go ahead.
I'm sorry. No, I was just going to say, I think we can probably all agree, as much as it's kind of stressful at the beginning, I think that those skeptical clients are always the best when you see results, because that you really had to do something to get that, buy-in from them. So
Yeah, exactly. I mean, it is amazing. We see it all the time, all over the country, so many different clients. It is unfortunate that it always has to be those clients that are just, they've tried everything. They've done the PRPs, they've done every different modalities, and they're actually at their kind of wit's end because it's such a unique experience, or it's such a unique modality that I still like to say it's the best kept secret. It's that, and then once you get those patients out of pain, it is absolutely amazing, because now they're going to go tell 10 people and so on. I guess my question then is, why is this such the best kept secret? Why is this direct current technology taking so long, even though it's been around the US for 20 plus years? Why is it so slow to adapt? I mean, slow in the sense of the outcomes, you hear it over and over, but for those out there that have never heard of it, why do you think, in your opinion, that it's taking so long for this to truly take off?
Well, I think if you're just going from a standpoint, like you said, of nobody really knowing exactly what it does, I think there are so many passive modalities out there that have been around for so long with very limited, not only results, but like Dr. Chris said, they're called passive for a reason. You're really just kind of dulling pain or putting something off for later, taking the edge off. And, this is one of the first, if not the first modality that I have any experience with that not only kind of requires that, professional input or professional, you have to do it in conjunction with all of the stuff, the skilled knowledge that we have and all of that. But I think that people just think of it, they hear it, they don't look into it, and they kind of just throw it in the same pile with some of those other things without realizing it. And then I think also because it does have, at surface level, a similar, it's electrical stimulation. So it's just some other type of TENS unit or something like that. So.
Yeah, that makes a lot of sense. I mean, I think the comparisons are I think, movement, as you guys know, in your space, in your practice, and really what's changing is movement is medicine.
Mm-hmm.
It is amazing that I've seen, and I'm relatively new to this space. You guys have been around it a lot longer, but, back in the not too long ago, you'd go to surgery and you'd be in a hospital for multiple days and then take it easy and, not really move. Now they literally want you in and out same day. They want you moving because movement's medicine. And I think this modality involving movement and as Dr. Chris mentioned, that ability to kind of re-educate the neurological, aspects of what's happening from that knee issue that you explained, going up a stair where you probably that particular individual, that knee is hurting because of compensations, because some muscle wasn't firing, something isn't working. It is exciting to hear kind of that. Dr. Chris, share with our listeners, are there any other aha moments that you've experienced with some patients or?
Well, the one you played in the intro video he's the first one that came to mind. He was a really fun client to work with, by the way. And his shoulder was a mess. He had tears. Just like you said, he tried the PRP. I believe he did stem cell. He could not golf. He was avid golfer, and he did a course of the ARP with us, and that solved the pain. And then we followed up with the home unit, the PRS, for him to continue strengthening on his own. I set him up on a program, give him videos of what exercises to do. And as far as I know, he's still golfing with no pain.
That's great. Yeah, I'd love to hear that. It is amazing. I'm so glad you guys integrated the over-the-counter device, right? Because, it is amazing technology. There's a lot of clinics out there that just want to treat, but to give clients homework assignments and a technology that they can, take home and use in between sessions, or in your case in Naples, there's a lot of snowbirds that go back up north because they don't want to, deal with the heat. Although I understand, Dr. Amanda, that you had some traffic, which is shocking this late in May in Naples. But, the reality of that take-home device, tell our listeners a little bit of how that helps your practice and gets the clients and your patients a little bit more, active with their own utilization of it.
Well, to be honest, we've only used it with a couple people so far, but I definitely want to build up that program.
Yeah.
So, I mean, that's a great point. I didn't even think about that. The snowbirds, that's a great way to kind of keep an eye on them throughout the summer. So that's an element that we want to bring into the business further.
Yeah. It makes sense because, I've got access to all this technology, but the last thing I'm going to do is try to figure out where I'm going to place pads, what I need to do. You still need an expert. You need a professional that's going to say, okay, here's what I think, here's where the pad placements go, and what movements do I need to try to re-educate or get rid of whatever compensation. So, you guys are invaluable. That's why I'm nice to Jake. I don't really like him personally, but he does help me through some pad placement stuff. So I love you too, brother. But anyways, so yeah, that's we're seeing that now growing and growing. I mean, obviously knowing this direct current was really, prevalent around all professional athletes, but now we're starting to see it with, regular weekend warriors or just anybody that's trying to get active. And so, that's exciting to hear. I think what are some of the, as you bring in new clients and some of the, educational aspects of this, tell some of our listeners, how do you integrate this? What do you do? Do you guys do a search? To tell us a little bit about how you actually take a new patient in and what they can expect.
So I'll start off and I'll let Amanda finish off the answer, because generally people will come to me for an evaluation first. And then, sometimes they're just going to do traditional physical therapy. I like to think of it as like kind of quarterbacking their health. Sometimes they'll go off and do lymphatics with Amanda, or oftentimes, especially if I hear the words chronic pain, I'm definitely going to set them up with Amanda. And then Amanda will take over and do an evaluation from there.
Good. And then when you get the patient, run us through a little bit about education, what you have to do to kind of explain what's going to happen and share with our listeners that.
Yeah, definitely. So of course it kind of depends. So more recently, I've kind of realized that it actually has some benefits for some of my lymphatic clients too, because a lot of the things that we're doing to address their poor lymphatics, like, the ARP addresses a couple of those things that are really important for the lymph. I'm sorry, my dog.
Your dog wants to be on the podcast.
I know.
Yeah,
fine.
Like,
this device can actually treat dogs as well. We've done it with dogs with physical.
And it's
arthritis,
big with racehorses. Not to shift gears, but now that we're talking animals, it's amazing because I found this out. We had somebody in Texas that was training racehorses, and they get hurt just like humans. And I thought, because they're so strong and muscular, believe it or not, this will shock you, I thought they were going to have to crank up the RX 100 to the max. Believe it or not, they were getting unbelievable results with the over-the-counter PRS. Yeah. And I guess, Jake, I'd love to get your take on that. I think because they're all muscle.
Mm-hmm. Yeah,
that it did not take a whole lot of the contractions to. So why is that the case? I don't know if I've ever asked you that.
So yeah, Matt, to your point, I mean, they're elite athletes, and we get the same response when we're working with NFL players, MLB, NHL, golf, where their muscles react a lot quicker. Their muscles are very reactive anyway, just naturally, and it doesn't take a lot for this device to start to wake it up again. And I think the horse on another level is a magical athlete in many ways. So something like this, it didn't take a lot, to get a very good response with it.
Yeah, that makes a lot of sense.
Yeah, it does make sense, because when you are strength training, like when you first start noticing, I'm getting stronger, it's not that the muscle has gotten bigger yet. It's that you have more neural sprouting. So you got literally more nerve endings and more neural motor units. So the stronger the athlete, the more sensitive the nervous system will be. In fact, the only person that I've ever been able to crank the ARP up to 100, he had foot drop. So he had like very poor neural tone. I think Jake goes to 100 though, don't you, Jake?
Yeah, but there's an intelligence lacking there where I think I don't feel pain for some reason.
He definitely got a screw loose for sure. But,
not that this is painful; it's just intense. No pain.
Yeah, I love it. When I first got introduced to this, my son had a broken leg, and they were working 20 treatments. They had a rod between his knee and his ankle, and they said, the orthopedic surgeon said he's done. There's no way he's playing basketball his senior year. And he went through 20 treatments. And when he came after the first session, like, I never had tried this. We get in the car, and he's dripping sweat from a 10, 15 minute, 20-minute session. And he was just walking in the doctor's office. And I said, wow, that looked easy. He goes, Dad, this is crazy. And then I'm like, okay, what do you think? He's like, let's do it. And he did the 20 treatments and got it up to 100. And I am a wimp. There isn't a chance that, and I think it's because you start understanding what it's doing. It was strengthening all those muscles. He's mentally strong. lot tougher than me. And being able to, and it's really not about the strength. It's not about how high you want to crank this up. It's really about the tolerance that you want, knowing that it's converting into strengthening and I mean, Jake, to interject there, like, because so many people, if you go too high initially, it's a shock. But tell the listeners a little bit about how you want to ease into a pain threshold that's tolerable.
And we've learned over the years, we've done a lot of work and a lot of studies through the course of the last 7 years where we've learned how to actually use this therapy better. But, we used to say the greater the intensity, the greater the change. And that is true, but we don't want to overload them with this information on the first session where they don't want to come back because, Dr. Chris and Dr. Amanda, as you know, if you do too much and they're too sore, they're going to miss the next session. Mm-hmm. And we have discovered that going lighter and kind of ramping them into it, Matt, to your point, as they start to fire up and the muscles are getting better at absorbing force, it's almost like the body craves that type of electrical stimulation when they start to see those improvements. And so they naturally do start to see those higher numbers. And in the case of your son, the doctor that was working on him, I know him very well. I know he didn't crank him right to 100 on the first session, right, but it took building blocks to get there. And then he was able to push because it was starting to absorb force and the brain was able to recognize it almost as a harmonious wave, after those multiple treatments. So yeah, definitely go high, but you want to get there naturally. It doesn't have to go to 100 to see results.
Yeah.
And I think Jake, I'm sorry.
Go ahead, Amanda.
I think you had mentioned this to me and it's really helpful. I think using hey, you tell me when you're at a 7 out of 10 or an 8 out of 10, because I think people instinctively want to say, oh, my 7 out of 10 is a lot higher. That they push themselves, it seems, a little bit more to get to some of those higher numbers when you kind of put the ball in their court to let you know what's high and what isn't.
Yeah, and it gives them a little control. Whereas originally we were originally taught that we had to get to a certain number, and so we were getting to these numbers when the patient was like, I can't take it anymore. And then we're like, yeah, this isn't the way we're going to do this. And we took it upon ourselves to change a lot of the protocols. And I think as a result of that, it's been a lot more successful. But I like the number system where the patient has control over it.
Yeah. On that point, have you guys introduced the foot bath, or tell us some of the different conditions and you take advantage of the foot bath? Tell us a little bit, our listeners, a little bit about how do you utilize the direct current device?
Go ahead, Amanda, you can take that.
Yeah. So the foot bath is actually what I've done probably the most of. I think there are a good bit of people that come in with plantar fasciitis and things like that. And there are some traditional PT things that can be done, but sometimes it's, a good companion, like Chris was saying with that. And it's nice too, because it is a little bit more passive. They don't have to do some of the exercises and all of that. So there's a little bit more compliance, I think, with, okay, I can do this. This one's a little bit easier than, like you said, you're not getting them up. It's not as high while they're trying to do squats or something else. So, and I think that it's really funny. This is just kind of personally funny to me, but people are always like, wait, you're going to shock me. You're going to put the electronic stuff in the water. So I think that's funny.
And Jake, you need to give some background, because we get that everywhere. I don't care who you are, every new clinic, every new patient, whatever. It's that, what? You're going to put this in, you're going to electrify, I'm going to get some current in this water. Please dumb it down for even me, because I can't even explain why this works so well when you utilizing water, like in a foot bath. Yeah.
It's not like throwing a toaster in a tub. So you don't have to worry about that. You're not going to electrocute yourself. It runs on a direct current, and the way it's set up is perfectly safe. It just stimulates the water. The water acts as a magnifier. And, to Dr. Amanda's point, it's a great modality if you have a patient where it's really tough to introduce them to something, especially when it comes to movement. I would argue the foot bath is a movement therapy. Because as you're turning it up, it does give some involuntary reaction to from the current based on what the water does, which is one of the reasons it's so successful. And then you have to like correct it yourself. And a lot of that's through breathing and then connecting back to the muscles down by the feet where you can extend the toes and you're sort of getting back into, a position where you're not compensating. So it's sort of a passive way of moving and neurologically connecting without taxing the patient, or if they just wanted to sit there and be lazy, like a lot of the athletes we work with. So foot bath is super successful. Once you get them past the fact that you're not throwing a toaster in a tub, it's perfectly safe.
Yeah.
I think of Micah. Micah's one of the trainers at our gym, and he's a total nut job. He's been in something like 11 motorcycle accidents, and the last one he went flying off his handlebars and hit the back of a box truck. And the only reason he's alive actually is because it was cold that day, so he happened to be wearing a helmet because he usually doesn't. Anyway, he's broken just about everything. So his knees are a mess, his ankle, his back. So it's like a great catch-all for him. So he just straps himself up to that all the time because it just kind of takes care of a whole bunch of things for him at once.
Yeah. Well, and speaking of that, I'm sorry, I keep interrupting.
No, it's good.
I think that's one of the things I like about the foot bath too is, sometimes with all those little muscles and things going on in the feet, it's nice to be able to do something that encompasses the whole, foot, ankle, and calf kind of in one.
Yeah, agree. I think that's great. So, how do you survive the summers in Southwest Florida, in Fort Myers, in Naples? Because normally it's a ghost town. I think more and more people are flocking to Southwest Florida year round. They're becoming permanent residents. The snowbirds, it's changing. There's still obviously a huge population that only winters down there, but I'm starting to see down there more and more people, becoming year round, and then they'll try to escape the August and September nightmares that, the storms, the hurricanes, all the other fun stuff that come with the living in paradise. But, how do you guys handle that? What are the things that you guys do when you've got an onslaught of patients in season? And then, kind of how do you guys manage your time and clinic when in the off season?
It's like $1 million question. I've been trying to solve that problem for a long time. The past 2 seasons I've survived because we're busy to the point where we're full in the summer, then we get overbooked in the winter. So past 2 seasons I've had a seasonal therapist. So that's the solve I have right now, but I don't know. It does seem to be that it's getting more year round here. So I think we're just going to get to a point where we're just going to have to continue to hire.
Yeah, I think that's great. You're seeing that a lot. And so, for people in the Southwest, Fort Myers, Bonita, Naples area that want to come, are you guys a insurance based or cash based? Tell the listeners a little bit about how they can come and get treated in your facility.
Sure. Yeah, we are out of network, so we don't bill insurance directly. So it's typically cash pay. We do evaluations for free, though, because we always have to make sure it's a good fit. So even if that's a physical therapy evaluation with me or first-time evaluation with Amanda for the ARP ARP Neuro, that's what they give the chances to experience it and see if they want to continue. So we do offer, we can do what's called a super bill, so they can self-submit for insurance, but typically most people just pay cash.
Yeah. I think we have so many, clinics across the country because it's becoming more and more prevalent because let's face it, when quality of life is affected, forget trying to deal with health insurance. Even going to the traditional PT stuff, which, getting right. Somebody to get some bands and, some kind of other modality, it's so time consuming that it's like, you just wasted another 3 months of your life versus diving in and getting something that's going to get fixed so you can get back to your activities.
That's exactly why I started Dynamic, because unfortunately the rehab world is kind of a disaster right now when it comes to insurance. Over decades have been cuts and more cuts. And so the only way to do the insurance thing, at least for physical therapy, is you have to see 2 or 3 patients at the same time. And so then the quality of care goes way down. Then you're hiring like a tech, which is basically like a high school kid that's like helping guiding just generic stretches and exercises. So it becomes like an assembly line. We call it like McDonald's PT. So we're just, you don't get good results that way. So you could go the insurance route, which usually take 3 or 4 months, or you could do like, a month or two with us, and you get way better faster.
Yeah, that's what we're seeing. So great. Now, are you guys Floridians, or did you come from some other area of the country? You know, what's your background? Where do you guys come from?
Ask Amanda how to say lawyer.
I'm from West Virginia.
Nice.
I love it.
I'm from Boston, but I've been in Florida for 20 years.
Okay.
Nice.
Good.
Yeah, I think West Virginia is probably the only way of saying things that could trump your Boston way of saying
Go ahead and say lawyer. Give me lawyer.
a lawyer.
A liar.
There it is.
I love it.
Liar.
We should have just asked you that. We would have known you're not a Floridian.
Well, he tricked me. He had somebody who he was working with who retired from that profession, and so he came in and he said, "Oh, you know, whatever," so that I would say it in front of him just to get his reaction.
That's funny.
Too much fun. Well, you got to have fun while you're working, for sure. Well,
Yeah, definitely.
you know what? You know, how can people get a hold of you? Do you guys have an Instagram account? Do you have
Yep. So it's at Dynamic Naples is the Instagram.
Okay.
That's our website too. Dynamicnaples.com is our website. Amanda has got her own Instagram, which she's building, right, Amanda?
Oh, nice.
It's called Lux Lymphatics, so she's kind of got like a business within the business.
Cool.
And yeah, you can kind of find us everywhere, TikTok, YouTube, everywhere. But generally, just go to the website and there's a contact us form right there.
Oh, very good. Look at this.
Yeah.
Sarah's on top of things today.
Thank you,
This is
Sarah.
great.
He always
Yeah, I don't
is.
know if you get a chance. You know, if you do post on Instagram, I'm not a social media guy, but I know we've got a ton of people posting and tagging us, and you know, it's kind of a whole unique art form that I'm not familiar with how that works with the music and the cool stuff.
Yeah.
On YouTube, we've got a lot of followers because there's so much good content that we put up there. And I have to ask, because I've got Jake's review coming up. You know, the training, is he available? Is he accessible? The videos. Tell me a little bit to close on, you know, how you've experienced with getting educated and trained on taking full advantage of the technology.
Well, I'd say that that's probably the biggest thing that has kind of kept me interested in this, other than, you know, the obvious success rates of everything, because there's been a few different times. One of them, actually, that client that we were talking about earlier, the aha moment, I wanted to make sure that we were doing everything right because of, you know, the severity of things. And I think 15 minutes after I sent him an email, he sent me an email back with a couple ideas to try, some videos that went along with those things. It was really nice. And then there was another time that I had a couple questions about some unique situations that I wanted to make sure ARP was a good fit for. And we scheduled a call. I basically got 2 pages worth of notes in like 15 minutes because he gave me so much information. And, you know, so he's always very readily available, and also with useful visual things, which I love. And Dr. Chris will tell you, I'm very much let me have all of this together so I can look at it. And you know, he's good.
Remind me to keep Dr. Amanda on my Christmas list.
This isn't good. This is not good. This is one I wasn't looking for that, because now he's going to be asking for a raise and bonuses, and oh my goodness. You were supposed to go, who's Jake? This is the first time I've met him.
Nope, I can't say that.
That's all good. Well, we cannot thank you guys enough for coming on today. You know, we love supporting you guys. If there's anything that you need from us, obviously we're here for you. Love what you're doing with the technology and direct current. We love how it's integrated, and we wish you guys all the best. And Jake, I don't know if there's anything you want to add.
No, I love to see the success of that clinic, though. You know, I remember going there 2 years ago, and I know it's getting busier because, you know, you're hiring, and, you know, Dr. Amanda wasn't there when I think I first started, or maybe she just started. So yeah, I always love to see the clinics like yours grow, because you deserve it, and people need to know about it so they can get some help, and they'll get help faster and better going there.
Well, thanks for that. Yeah, it's been a wild ride, and I really appreciate you guys, and I love having all these tools in the toolbox.
That's good. Yeah, I can't wait to see some of these posts, Amanda, from this Instagram. Please tag
I know Dr. Chris has been on me. He's great at it.
Yeah.
Excellent.
It's got a lot of
Good
good stuff
That
on there.
stuff, so
I love it. Well, listen, you guys have a wonderful day. Stay safe, enjoy the summer heat, and wish you guys all the best.
All right,
you
thanks.
too. Thank you.
Thanks a lot,
Guys,
everyone.
take care.
Take care.
Bye, guys.